you advocate for the use of facial feminization techniques beyond the transgender community. So what benefits do you see in both cisgender women and transgender women? You know, how do your techniques then differ for those two different patient populations?
Facial feminization, learning the techniques of facial feminization just basically changes how you analyze a face in general. And so I basically, if someone wants to look more feminine and more attractive, I look at their face in the same way, essentially. And if you think about it, even aging face procedures are feminizing because looking young is a part of looking feminine. And so facelifts, even rhinoplasty, brow lifts, they're all part of facial feminization.
You are listening to the Pinnacle Podcast, where we empower women in medicine through education, community, and actionable strategies for both the practice and the business of medicine.
Medicine is a lifelong career, and continuing education is crucial for professional development. Pinnacle is the first and only multi-specialty organization dedicated to addressing the challenges that all women in healthcare face.
Welcome to Pinnacle, the elite professional community providing education for women in medicine. At Pinnacle, we challenge you to pave your own path by helping you develop the skills needed to not only stay in medicine, but to excel. Well, hello, everyone. Welcome to the Pinnacle Prescription Podcast. I'm your host, Dr. Rupa Wong, and today I'm joined by Dr. Sarah Saxon for Plastic Surgery and Confidence, Facial Feminization Surgery. Dr. Saxon is a board-certified otolaryngology, head and neck surgery, and facial plastic and reconstructive surgeon. She's in private practice at Saxon MD Facial Plastic Surgery. She is one of the nation's few experts in facial feminization surgery and uses craniofacial and soft tissue techniques to create a more youthful and feminine appearance. Dr. Saxon, thank you so much for being here today.
Thank you for having me.
Well, there's a lot that I want to ask about your training, your path, what you do currently. So let's just start at the beginning, if that's okay.
Sure. Yes.
Before you even became a physician, because I found this so interesting when you sent us this little tidbit of information. Tell me about the transition from being an artist to becoming a facial plastic surgeon. First, what kind of artist were you? And
yes.
Then how did that lead you into medicine? And how has your artistic background played a role in your medical career?
Yeah, well, I started formal art training actually in the second grade. So believe it or not, my elementary school, they had a gifted and talented art program, and they chose me among 3 other people to take a test and qualify to be in this gifted and talented art class. So I didn't know what that was based off of or anything. I guess they looked at our, colorings and craft projects and saw an aptitude. But so that is where it all started. And so starting in the second grade on, I was in art class, kind of explored all mediums. And then by the time I made it to high school, I really realized that I really loved portrait drawing. So my art teacher in high school, she would, if she had someone come to her for a portrait to be made, either for a gift or something like that, she would refer them to me. And of course, it was just kind of, mailbox money for me at the time, just, maybe $50 for a portrait. I'd pay for gas to go to the movies with friends or something like that. And so when it came to, well, first of all, I was an art geek and a science nerd in high school. So when it came time to going to college, I had to make the decision either to do something like interior design or architecture or fine arts versus sciences. And I thought it would be easier to make a living as a physician rather than an artist. And so pretty early on, even freshman year of college, I decided I wanted to be pre-med, but I specifically wanted to do plastic surgery of the face. And I didn't know it was a specialty at the time, but I thought I would have to do plastic surgery residency and just decide to do facial work. But the good thing is, by the time I made it to medical school, I found a mentor who was a pretty well-known facial plastic surgeon, and he guided me along the way. So that's basically how that happened.
That's amazing. And I'm sure that your skills as a portrait artist are absolutely influencing what you do today. Do you still just do art for art's sake?
I wish I had time to, but I basically figured out that I still do, but in my work every day. My medium is just skin and bone, and do sculpture that way rather than with pencils and clay. And so every day I feel like I'm doing art, but it's just in a different way than I ever imagined.
It's amazing. It's really amazing. And the way that you've been able to draw that into it. You went into college knowing exactly what you wanted to do because of this aptitude that you had for art and portraiture, which I love. So I know that you are one of the very few experts in your particular field in the country, and that you teach your advanced techniques to other surgeons nationwide. So what was the path that you took? You touched upon it a little bit. You had a mentor, but if you can guide us through, is that path that you took the only way to get to doing what you do, or are there other ways as well?
Well, like I said, my mentor in medical school, his name was Dr. Richard Holt. He was retiring at the time, and he wanted me to be in a program that he knew I would thrive in. So he basically cherry-picked my residency program, which was University of New Mexico. He knew that I would work under Dr. Michael Spafford, who he knew from Johns Hopkins, and who's probably the two of them are the most ethical physicians and surgeons. They're kind of the people in your mind that you would never live up to, but they think the opposite of you. Does that make sense? So Dr. Spafford and Dr. Holt would always be in the back of my mind in difficult cases. You know, what would Dr. Spafford do? What would Dr. Holt do? And so I was lucky to have that. But New Mexico is a very interesting place. It's probably one of the most underserved locations in the country for healthcare. And so we only had one resident a year in my program, and it served the whole state, basically. Even as far as West Texas, Southern Colorado, Eastern Arizona, everyone would basically fly in to UNM. It was the only level 1 trauma center in the state. And so the areas of facial plastic surgery that would normally each be a separate fellowship, I was getting more experience as a resident than I would at those fellowships. So when I was interviewing for fellowships, I would ask how many cases of cleft lip and palate or microtia or facelifts or what have you, and I was getting more cases in my residency, even in my chief year, than I would have in that fellowship. So I had to kind of decide what I wanted in a fellowship at that point. And so when I visited Dr. Jeff Spiegel's fellowship in Boston, it was something I'd never ever seen before. And Dr. Spiegel pioneered all the techniques in facial feminization. And so the day I spent with him in the OR during my interview was just something brand new, and it excited me. And I ended up matching there, and I loved it. So I knew that I would be able to use those techniques in anyone. Back then, gender affirmation surgery wasn't as well known as it is now. And so he was really the only person that I know of that was doing a lot of it. And then by the time I ended my fellowship, that's when Caitlyn Jenner had come out and had her surgery. And it like the beginning of the tsunami of patients came out to have their surgery at that point, and a lot of people that didn't know what was available all of a sudden said, wow, that's what I need. And now there are surgeons all over the country that do it, but not to the same techniques as Dr. Spiegel. And it's very difficult to find a really experienced facial feminization surgeon. And there are a lot of people now still, wanting to learn and, travel to, watch me and others in the OR just to figure out, there are other surgeons in the academic centers that they're seeing those patients, but they don't know yet, what techniques to use. So it's still brand new and exciting, but I'm excited to sort of expand facial feminization surgery beyond just gender affirmation surgery, because I see cisgendered women from all over the country for the same procedures as well.
And I want to touch on that for sure, but I want to back up because you said so many interesting things that I think really highlight your journey. First, the power of mentorship. You had several key mentors throughout your educational journey, and they were different. And I think that's something to take away. I've also had different mentors for each part, sometimes several mentors or even sponsors. And that really seems to, and they don't necessarily all agree or do the same things, and they serve different purposes in your journey. And I think they seem to have quite an impact on your eventual, path.
Right, exactly. I wouldn't be where I am now without them guiding me along the way. So.
And then you also mentioned that you are the only resident. You're at this crazy busy program where you are doing so much. You drew from that all of the experiences, all the surgery, but it must have been really tough when you were actually a resident. I can't imagine, were you Q1 just always on call?
Yes.
How did you mentally get yourself through that kind of program? I mean, you knew that you were getting the best education, but that must have been really challenging.
It was really hard. And I think in the end, now I look back on it fondly, but at the time you think, wow, I'm never going to push my body this hard ever again. I was a little burnt out at the end. We took call courses junior residents, but even as a chief resident, I took solo call without, just overseeing juniors. It was just myself. We had a couple of PAs that I also did backup call for. So I essentially was on call all the time. And because it was home call, we were able to sort of get around the 80-hour work week rules. But I mean, we all know it was more than 80 hours when you count the working from home aspect. So I'm thankful for it now. I'm a better surgeon because of it. But at the time, it was really hard.
Did you have anything that helped you get through it at the time, just for our younger listeners who are at that part of their journey?
I think a good support system. I'm really thankful that my attendings were very supportive of us. And when we did speak up and say, hey, we need help, that's when we hired the PAs in our group. They have 2 residents a year now, so they're constantly, trying to increase numbers. But I was there at a transition time when we had a lot of attendings, but not a lot of residents. But they viewed us, especially as senior residents, more like attendings, and we functioned pretty independently a lot of the time. And so they valued our input a lot. And I was really thankful for that. And my co-residents were like my siblings, so we got along really well.
I love it. And now to get back to something you mentioned, I think it's really fascinating. You advocate for the use of facial feminization techniques beyond the transgender community. So what benefits do you see in both cisgender women and transgender women? And how do your techniques then differ for those two different patient populations?
Yeah, so facial feminization, learning the techniques of facial feminization just basically changes how you analyze a face in general. And so I basically, if someone wants to look more feminine and more attractive, I look at their face in the same way, essentially. And if you think about it, even aging face procedures are feminizing because looking young is a part of looking feminine. And so facelifts, even rhinoplasty, brow lifts, they're all part of facial feminization. The big picture in facial feminization is to make the eyes look a little bigger, make the lower face look a little smaller, make the skin look smoother, allow light to bounce off the skin in ways that bring more light into the eyes. And so that's why aging face procedures also play a part in feminization. However, I do craniofacial surgery as well for feminization in cisgender and transgender women. So I do what I simply term brow bone reduction, but it's a cranioplasty. where the frontal bone is set back, and I'm able to go into the frontal sinus and set back the anterior table, use titanium plates to keep it in the right position. I actually make the eye socket a little bigger and smoother, and so it allows more light to hit the eyes. And there are a lot of women that have a prominent brow ridge that they just go to other surgeons and get offered a brow lift, but they'll have a brow lift and then they don't quite get the result they're looking for because they still see shadowing in their eyes, which makes them look more masculine. And so they come to me to perform more bony type procedures, and it gives them that extra level of aesthetic that they couldn't have otherwise. There are other procedures that are becoming more common, especially in Gen Z, Gen Alpha even, because they're just really educated beyond what I was at their age. So jaw contouring, making the jawline slimmer, is really popular in that age group.
How do you do that? I mean, it must entail breaking these bones somehow.
Yeah. Well, most of the time I can just contour the bones. I make incisions inside the mouth, and then it's like sculpture, like we talked about. So I'm able to narrow, my main limitation is the mental nerve and the tooth roots. And so I can actually narrow the bone basically to the marrow space and get a fairly narrow profile. Every once in a while I have to do something called a sliding genioplasty, where I make a cut in the bone just under the mental nerve and slide the chin either forward or backward, depending on what they need, and use a titanium plate to keep it in place. So those are really fun procedures. Jaw procedures have much more downtime, and so I have to prepare patients for that. But the forehead procedures, after a week or two, they're back to work and back to normal activities. So pretty amazing what results you can see.
That's amazing. And do you do all of these procedures at the same time? Are you doing the orbital bone and the frontal and the jaw at the same time, or do you stage it into just various different surgeries?
Yeah. Well, the surgery center, I'm in the process of building out my own surgery center right now, but so that's exciting.
Yes.
But the surgery center I go to at the moment limits me to between 6 and 7 hours. And so usually I can get all the bony procedures done at once. But if I have an older individual who also needs a facelift and blepharoplasty and all those things, I'll stage that part out as a second procedure. I'm not sure, even when I have my own surgery center, that I want to go beyond 7 hours because I don't have residents or fellows. And so it's just really taxing on your body to do surgery that long. And in facial surgery, you're contorting your body in weird positions and looking in deep, dark holes. And by the end, you have to go get a massage. And I need, it's a marathon, not a sprint. So I need to prepare my body for a long career. So
Absolutely. We had someone come into our surgical center and assess our posture, the way that we were holding instruments, and even our surgical assistants, and then making recommendations based on, because so many ophthalmologists, as I'm sure facial plastic surgeons, end up disabled because of neck issues and can't work. So I thought that was really interesting. You should have you had that done?
Absolutely.
You should probably get
I should.
You should probably get that done. Because mine are 2-hour cases. Then I, 2 at the max, 2.5 if it's really complicated. But they're longer than the traditional ophthalmology, but certainly not a 7-hour case. Or if you were to do all of it, it would probably be 10, right? 10, 12.
Well, in my training, we even did 12, 15-hour cases. It was pretty commonplace, and you just can't do that for a whole career and still be healthy.
Absolutely not. And it's good to recognize that. I think that's very important for just physician well-being in the future and for your longevity of your career. All right, the work you do, as you're describing, it seems really just obviously life-changing. It would just be an understatement. Do you have memorable patient stories that you can share, just how facial feminization affected their someone's confidence, their life, within the transgender or cisgender community, anybody?
Yeah, well, really, I think for anyone having facial feminization, a lot of times I see them come in almost like they're really quiet. They're kind of almost like they're in their little cocoon, and it's so funny to me because after surgery, I see a whole different side of their personality come out. And, oftentimes they may get a job promotion or decide like, hey, I'm going to have a big transition in my life and move to Seattle. Or, some people even have the confidence to like have a divorce sometimes, unfortunately, but they're in a toxic relationship that they didn't have the confidence to get out of. So I see a lot of people in transitions in life, which is interesting because a lot of times half of my job is almost like psychiatry and the other half is surgery, and so I'm able to be with them through all those transitions, which is really nice as well.
I mean, it probably is part psychiatrist, right? You also, I'm imagining, have just a radar antenna up for any kind of body dysmorphia or someone that wants too much or wants something that's unrealistic, right? That you have to then set those expectations.
It's hard, though, because so many people know that the right things to say at this point. So we are recently adding in a questionnaire that everyone has to fill out for body dysmorphic disorder just as a screening tool, because sometimes it's hard just in the interview really teasing out those red flags. But most of the time I can sense it during the consult.
Yes, I mean, just because there's so much online, so they know what they need to say, right? Or they maybe even convince themselves.
Exactly. Mm-hmm.
All right. So what are some common challenges or misconceptions that you encounter when you're discussing facial feminization surgery with either your patients or just your peers, your med school classmates, or you're talking about it at a cocktail party? What kind of misconceptions do you encounter?
Well, I think people automatically box facial feminization into gender affirmation surgery, and that can be a little controversial right now. I'm having a hard time even in our conferences, expanding it beyond one small room with a few surgeons that we all know each other and we all know our techniques anyway. But even in trying to expand different talks and at different national meetings to spread the word, because the younger generations are asking for these treatments and these surgeries. And so I do want to teach, and I want to make sure that people are using techniques that aren't unsafe. And so it's been really difficult for me when I'm introducing topics for conferences for it not to get shut down, because they just want to put it in this one room for gender affirmation surgery. And that's great, but I'd like to do both,
And you want to educate for people that may not be taking care of transgender individuals who might need to do these techniques for their patients as well.
Exactly. Mm-hmm. And they're useful too with other medical problems. So because I'm so comfortable in the frontal sinus, I used to be in academics. I was at UT Southwestern. When I'd have someone who had a frontal sinus injury, the rhinologist would call me to do a frontal sinus obliteration and repair the anterior table of the frontal sinus, like with the titanium mesh, things like that. It's just because I'm in the area so much that I'm able to fix those things as well. So it's not just with facial feminization that the techniques help with, it's with everything else too.
I mean, your knowledge of the anatomy must be so amazing and so expert. That's the part of we're close. We're very similar with your part. I avoid that.
Well, actually, funny you mentioned that. At Pinnacle, I was talking to an oculoplastic surgeon, and she said she had run across a few patients with strabismus after cranioplasty for facial feminization, and that was new to me. I hadn't seen that before, so I think they're about to publish a paper about it.
That's interesting. I had seen they had done a presentation at our pediatric ophthalmology meeting about at UCSF from their surgeons, because they do a lot of feminization surgery for transgender individuals, and looking at the orbital reconstruction. And I mean, I could imagine that it's obviously very close. I haven't seen it personally. We don't have a lot of, we don't have surgeons that really do that here in Hawaii, but look out for that paper. That sounds very fascinating. I should probably know about that, since they'll end up on my door then, maybe.
Yeah. Yeah.
What do you think, looking forward in your field, do you think is going to be evolving, especially, concerning non-traditional applications of these facial feminization techniques? Do you see it branching out in a different way, or new, new lasers, or where do you see it going?
Well, I think in mentioning, Gen Z, they're very comfortable with asking for feminization procedures, because most of the filters on social media actually feminize the face. And, K-pop stars are really popular. They get a lot of feminization procedures as well. A lot of things start out in Korea and then make their way over here. And so it's a matter of time before it's just part of our general techniques we all learn in facial plastic surgery that most surgeons, I think, will be adept at. Just like when I was in training, most people didn't train to do a deep plane facelift, and now that's what we're all doing. So there will be a time where I think everyone will have to go to courses and go to specific conferences just to do and learn facial feminization surgery, and then eventually we'll all be doing it. And I think that's the direction it will go. I'm already seeing it with procedures like lip lifts and hairline lowering and jaw contouring. When I first started my practice, most people weren't doing that at all, and now it's one of the more popular. Those are one of the popular procedures we have, especially in-office procedures for lip lifts. A lot of surgeons are doing that now, whereas even 5 years ago, you didn't really see it a lot.
Interesting. And I hadn't even considered about the filters, and it seems like it's just makeup. And I remember taking a little screenshot when I had a filter on, not that I used it, but I was like, and I gave it to my makeup artist before I was going to do some TV. It's like, can you do make face like this? And she's like, well, actually not always, because it's not just makeup.
Yeah.
It's actually like a different face. Oh,
okay. Right. Yeah, a lot of the filters make the jaw a little more narrow, make the eyes a little bit bigger, and smooth out the skin texture. And just little nuanced things that just doing, Botox and filler and your standard procedures wouldn't really achieve. So
yes, and that's important for people to understand and recognize, because then again, they have to know that these are surgical interventions and not medical ones, or even cosmetic ones, as I thought mistakenly.
Right.
All right, this is one thing that we ask all of our guests. What is your pinnacle pearl to share with other women in medicine?
I was thinking about this, and I think it would be to live each day like it's your last. Because before I transitioned from academics to owning my own practice, what spurred that transition is my mom being sick. She had pulmonary fibrosis, and she ended up passing away. And after that, it changed my whole perspective on life and my career. And I just look at it as, I could get in a car accident tomorrow. I could, who knows how long we're going to be here. So I want every single day to count, and for my work and my life to embody that, to where I'm just thankful for every single day. And I want to prevent burnout, like what I talked about in residency. And so I tailor my whole life with that mindset.
That's wonderful, and I completely and wholeheartedly agree with that. What changes have you implemented, if you don't mind me asking, in your daily life to get to that point?
Well, part of it is my new clinic that we just opened. When I started my practice, it was downtown Austin, and I ended up moving out into the suburbs, which I never thought I would do, but I just needed a little more quiet. And so it's about 20 minutes outside of town, and when that happened, I loved it so much out here that I decided to move my whole office and build a surgery center out here. I don't want to commute and spend time in the car. And I gear my day-to-day schedule like that too. So every Monday I have an admin day where I can do meetings or film content, and then the rest of my days I have a strict schedule so that it's not chaotic, and I can go home and I can relax, and I have an end and a beginning, because you can work forever if you allow yourself to. And there's always a to-do list, but I have to cut it off. That keeps me sane.
Absolutely, because I think all of us, the Pinnacle community, women in medicine, we will keep going and keep doing and keep checking off things on our to-do list and adding more things, unless you cut it off, like you said, and make those really intentional changes, which might even seem, I mean, obviously it's not simple to move your whole office and your practice, and it's daunting, but the quality of life that it probably gave you back, it just can't be measured.
And I forget it every once in a while. So a couple of years ago, I opened a satellite office back in Dallas, and I had a staff there. I was doing surgery there and going back and forth, and just decided I can't do this anymore. And so now I just go twice a month, and I bring my staff from Austin up there. I don't have to worry about overseeing staff that's up there that may need more oversight. And then actually a friend of mine, Dr. Ashley Agan, she was at Pinnacle as well with me this last year. She just opened a direct care ENT practice, and so she subleases that space when I'm not there. And so it's a perfect scenario for both of us. I don't have the pressure to be up there all the time, and she uses the space, and so it's a win-win for both of us.
What a great way to make it work for you both, and to be able to help a colleague too. So that's really amazing. But I think sometimes it just takes thinking outside the box, and then also recognizing what your limits are. Even if you can open up a second satellite office, doesn't mean you should, right?
Right, exactly. I have a few more years on that lease, and so I have to decide if it's going to be worthwhile to keep. I think it's fun when I go still. The staff that I bring up there, it's kind of like a mini girls trip every time. So I think they love it. So right now it's definitely worth it, and I love going. So
That's great. All right. Tell everybody where they can find you, where you are online, where's your practice, all of it.
Yeah, so our website is saxonmd.com, so I have a lot of information there. I post blogs. I also post a lot on Instagram at saxonmd. And of course, we have a Saxon MD Facial Plastic Surgery YouTube channel that we're trying to build up as well. Maybe one day I'll have a podcast, but not yet.
I love it. Thank you so much, Sarah, for being here with us today. I learned a lot, and it's such an interesting field, and the way that you've navigated it is also so amazing. So I really appreciate your time.
It's been really fun. Thank you so much.
Thank you for listening to the Pinnacle Podcast, where we strive to elevate the voices of women in medicine and inspire excellence across the healthcare landscape. Until next time, keep reaching for your pinnacle.